Okay, the next portion of the medical aid is what they call the primary health care benefit. So this is the basics that all medical aid, according to legislation, have to offer their clients. And that's also as part of the pooled risk benefit. So your primary health care benefits will be paid out of pooled risk as well. So included in your premium, and again, because they have to offer this to all clients, that also pushes up the premiums because they have to calculate that into their pooled risk premiums. But primary healthcare are the basics. For example, they have to give you at least a dental checkup once a year, a GP checkup once a year. So when we talk about dental checkup, it is not doing fillings or any of that. It's just literally having an appointment with the dentist to have checked that you don't have any fillings. So make use of that. I see a lot of people, they haven't gone to the dentist for freaking years because they feel they don't have any cavities, they don't have any pain, therefore it's not necessary, and they don't want to spend their savings or their day-to-day expense on that. But you have a free session, a checkup with the dentist once a year. They have to offer you a free eye test I think it's every 3 years or so. And then they're specific for males and females, where males over a certain age can go for a prostate exam as part of their primary healthcare benefit. Also included in the primary healthcare benefit are things like antiretroviral medications. I think the COVID vaccine has now been included into that primary healthcare benefit as well. So if you get your COVID vaccine, even though you tell them you have a medical aid, it is then paid from that primary healthcare benefit of yours. It won't come off your day-to-day benefits. So that is the bottom part of your medical aid, that it's just the primary healthcare. So even if you only have the hospitalization portion, you will still have that primary healthcare as well. Then the next level is the day-to-day medical expenses cover. So the day-to-day medical expenses is going to the doctor for a consultation, going to the dentist to get fillings done, going to the optometrist. All of those kind of things are paid from your day-to-day. So there is 3 options that you have in the medical aid market on how do you cover your day-to-day. The first one is the traditional option. That's how medical aids worked when I was a child. The traditional option is everything around the traditional option is part of the pooled risk. So you pay one premium and all your day-to-day is covered through that with sub-limits. So with the traditional option, you will be able to go to the GP, get unlimited medication up to a limit of whatever, 50,000 Rand for the month, for the year. So those sub-limits are there, but there's no specific savings pool that gets depleted throughout the year. You can keep going as long as you stay within those sub-limits. At the moment, the traditional options are so expensive that very, very few people actually use the traditional option. You're talking about some of the traditional plans works out to over 10 to 15,000 Rand per person. So it is just absolutely ridiculous. So very, very few people are still on these traditional options. But if you really want to, you can. I wouldn't suggest that. The second portion of day-to-day cover is what they call capitated funds. So a capitated fund is also a type of a pooled risk way of looking at your day-to-day expenses. And how a capitated fund works is they link you to a network of GPs and a network of optometrists and dentists. So there's these dentists, GPs, etc. on a list that is a network of them that have an agreement with the medical aid. You can then, through that capitated fund, go to the GP as many times as possible, or not as possible, as many times as you need to, and If you go over a certain amount, let's say 10 visits a year, you then have a small co-payment like 25 Rand that you pay extra if you go and see the GP more than 10 times. So all your GP's visits are included, all your dentist visits are included, with basic dentistry included as well, fillings, all of that as part of your capitated. But you have to visit one of the network GPs, one of the network dentists. Basic blood tests are included in that as well. So typically the capitated fund sounds fantastic, but for people that really, like people with children, it doesn't always work that well, because when the doctor prescribes medicine, they have to prescribe medicine from a specific formulary. So if they don't prescribe the medicine from that formulary, you will have to pay out of your own pocket. So what I've seen happen so often is that the doctor doesn't even have the formulary with him. So he just prescribes what he thinks and what he's used to prescribing for specific conditions. And then you get to the pharmacy and they say, well, this is not on the formulary, so you have to pay out of pocket. And then people get very annoyed. The same with blood tests. There's specific codes, and the people at the labs don't always use the right codes, and that creates an admin nightmare. So in theory, capitated funds sounds very good, but in practice, it doesn't always work as well as you think. Where capitated funds do come in, and again, medical aids are required by the government. This is something that a few years after the new legislation came in, the government brought in, is they have to have plans that cater for low-income individuals. So those plans are linked to the individual's income. So, and all of these low-income medical aid plans, so this is specifically for people like pensioners that don't have a high income, young people that aren't earning a lot of money yet. They can go onto one of these plans and get medical aid that is much, much more affordable. But all of those plans are part of this capitated, where you will get linked to a group of doctors. So for those kind of individuals, it works quite well. So it's something that you really want to look at if you are a pensioner and you want to reduce your cost. Somebody that earns less than, say, 5,000 Rand a month might pay 800 or 700 Rand a month for a full medical aid with doctor's visits, blood tests, everything included, which is really reasonable. So for those kind of people, I think it might be something to look at. The last portion is your savings portion, and I would guess probably about 90% of medical aids day-to-day cover is done through this method. Usually how they work is a percentage of your total premium that you're paying for medical aid, anything between 10 and 25%, is contributed towards a savings pool that you create for yourself. So here it is not a pooled risk benefit. It is your money that you use. So let's say it's 25%. So if you are paying 3,000 Rand a month for your medical aid, 700 Rand a month of that will go into your savings portion. Usually at the beginning of the year, in January, the medical aid allows you 12 months of that as credit. So let's say 700 times 12, it gives us 8,400 Rand for the year that you will have available in your savings. And then all of your day-to-day expenses gets paid out of that savings plan of yours. So this is now up to you. If you spend all of that by going to the doctor 5 times in January and then going to the dentist, getting new glasses, and it's done by February, that's it. Then the rest of it is out of pocket.